Good afternoon, everyone, and thank you for joining today's webinar. This is Leslie Lowe. Our first presentation today is with Eric Weiss, the Division Director for the Division of Rehabilitation Services. As we go through the presentation, feel free to unmute yourself and ask questions or use the Q&A to ask any questions you may have, but we'll also likely have time at the end of Eric's presentation to answer any questions then. So if there's nothing else, we'll go ahead and have Eric get started.
Okay, thanks, Leslie. Again, my name is Eric Weiss. I'm the Director of the Division of Rehabilitation Services. So good afternoon, everyone. I've got some slides prepared and a little bit of narrative for you to attempt to give you an overview of the Division of Rehabilitation Services. And for my understanding is that most of you are out in the field working with individuals on a daily basis. You're possibly familiar with some of our staff in those offices and what they do. So I'll attempt to give you a broad overview. Some of it will maybe be really familiar to you as we go along here. First of all, the mission statement of the Division of Rehabilitation Services is to assist individuals with disabilities to obtain employment, economic self-sufficiency, personal independence, and full inclusion into society. And we do that in a few different ways that I'll cover here in the next several minutes. Next slide, please, Leslie. This is just a broad overview of the division when it comes to FTE. When it comes to the administration staff here in state office, Bernie Grimmie is our assistant director, and he is primarily responsible for the vocational rehabilitation program. Steve Stewart is our rehabilitation engineer, and his specialties are the Americans with Disabilities Act and assistive technology. And I'm sharing some of this information because it may be valuable if you run across potential, if you have questions out there in the field or have questions, you can certainly contact your folks at LTSS or myself or these individuals if you have more questions on something that they have primary responsibility for. Becky Bloom is our support staff here in the building. Janet Ball is a program specialist that has a primary focus on services to people who are deaf or hard of hearing. Julie Pollock is our staff interpreter here in the building. Mitchell Close is a program specialist with the division, and he has been primarily responsible since he started last December in handling everything to do with development and production on our case management system. And Jennifer Guther is our program specialist that is primarily involved with independent living and is our waiver manager for our ADLS Medicaid waiver. Two other members of our DRS management team before I continue. Joanna Fisher is the Director of Disability Determination Services, and DDS is the unit, the agency in Sioux Falls who makes eligibility determinations for all the SSI and SSDI claims in the state. And then Kimberly Hoberg is our business specialist, and she is located out of the Aberdeen office, but she is our single point of contact for businesses that are looking for help in hiring people with disabilities. So next slide, this is just in general, the map, the coverage areas for our field offices. The VR program has 5 district offices, Aberdeen, Rapid City, Brookings, Sioux Falls, and Yankton, and then a total of 11 field offices. So some of those offices are smaller offices. The district office supervisors are found in those district office locations. 8 of the 11 offices are co-located with Department of Labor and Regulation, or DSS, and 4 of those offices, Spearfish, Huron, Mitchell, and Chamberlain, are one-person offices. So We do that probably in a similar fashion to how LTSS does it, to make sure that we're able to effectively and efficiently cover the entire state. All right. And I should tell you, I don't know if I cover this later or not, so I'll cover it now. When it comes to finding out who to contact and how to contact, I think that's an important part of this presentation today. No doubt there has been and will continue to be crossover when it comes to people that LTSS is serving in whatever capacity, whether it's through a Medicaid waiver or another program, and we're serving the same person. We're providing services to the same person. So when it comes to contacting one of those offices that you see on that map, the best place to find that contact information is on the DRS homepage, and I'm sure everyone knows how to find that information. It's got a DRS office, locations, and counties served. So sort of it puts that map into text and then includes the contact information. And then that same map you can find out on our website as well. Okay. But I think that's important as the really practical part of this presentation is, if you find someone, if you're working with someone who needs independent living services, for instance, or needs vocational rehabilitation services, how do you get in touch with the staff? And that's your first step there. Next page, our primary program, I guess, in DRS is the vocational rehabilitation program. And this slide, I won't read every word verbatim for you on this slide, but basically this slide talks about the impact that VR services can have on an individual's income. And I should say too that the VR program is providing employment services to individuals with disabilities to help them keep or get employment. But the real value there, I think, is for the dollars that we spend for services, hopefully those individuals are successfully rehabilitated in the end and are, their earnings are increased as a result. According to 2015 statistics, South Dakota ranked second in the nation of the percentage of people with disabilities that were employed, and at 51.7%, that was over 15% higher than the national average, which is really cool. I think it says every bit as much about just the makeup of the people in the state as anything else. I mean, it's not like I'm claiming sole success for that or anything like that, but
we're just really hard workers as South Dakotans.
Well, you know what? You've probably heard that before, yep. And this is a statistic that points directly to that. Mm-hmm. So
that's pretty amazing, though. Quite the difference for them.
It is quite a difference, and it's also interesting to note that we also have one of the smallest gaps between the employment rate of people with and without disabilities. So I'm saying ideally your employment rate of people with disabilities is the same, right? Well, that's not the case, but our gap between the two is one of the smallest in the nations too. So it's very cool. So like I said, this slide just speaks about some of the, it gives you a little bit of information on the return on investment through the vocational rehabilitation program. A little bit about eligibility. The key factor here is that there must be a disability present that is a substantial impediment to employment. So a VR counselor is going to, once a person applies for services, support staff and a counselor are going to collect all the necessary information needed to make that eligibility determination. And if there's records that aren't available or information that isn't available that VR needs to make that eligibility determination, then that's gonna take place sometimes with the person's involvement, but it's not going to. The person doesn't have to pay anything to help collect that information, right? Whether it's them going to an exam or whatever, the person has no financial responsibility there. And in fact, if they have to travel somewhere to get that exam, then it's something that we help pay for as well. Okay. As I noted a little bit ago, when it comes to applying for services, contacting an office, the best resource for that is on the homepage of the DRS website. And there also is in those offices, there's informational brochures, and if you'd like me to, Leslie, I can get you some brochures to pass out to staff after this. Share some hard copy information.
Actually, the supervisors are all here right now, so that'd be a good time for it.
Yeah.
Mm-hmm. Now
actually,
they all have information on services of blind and visually impaired,
okay.
And like Julie and Janet came over and did that presentation last year, so they likely have
information on the telecommunication equipment distribution program and such. Okay.
Yeah. Well, most of them.
Well, after this, follow up with me. I'll find you some brochures to share. We don't have a large stash of them here anymore. We kind of relocated that warehouse of hard copy brochures to Aberdeen, but I know we have some still here that we can share. Okay.
Yep.
A little bit on who we serve in the vocational rehabilitation program. There were 2,521 individuals applied for VR services in fiscal year 16, and the VR program served close to 5,000 people, 4,967 clients. Out of those, over 600 of those applicants in FY16 were under 20 years of age at application. So that gives you an indication of the type of individual we're serving. In fact, and I think you have SBVI scheduled for a little bit later today. Their average age of application is approximately 15 years older than ours. We're just serving a larger number of students with disabilities, and really, and it's just due to the nature of the disability why there's that difference. Services are time limited, so limited to the time that it takes to obtain the person's employment goal. So it's not an ongoing service. Doesn't mean that a person can't come back and reapply for services if something doesn't go right in employment. They lose their job, they want something else, so on and so forth. But it's not it's a time limited service. Yeah. 769 clients were closed successfully, employed in the same fiscal year. The average client is served for approximately a year and a half, at a cost of a little over $5,000. So it gives you an idea of the duration, and this is an average, of course. So some individuals are relatively short period of time that we're serving, and some we may be providing like a help with post-secondary education, and it may be involved for several years during the person's time. A little over one third of our clients receive supplemental security income or Social Security disability insurance at the time of application. And we work with a variety of people, people with a variety of disabilities, cognitive disabilities, physical disabilities, mental disabilities, and sensory disabilities. So it really varies. Everything except for, and I'm sure Gay is Gay that you're talking to later. I'm sure she'll share this with you too. If a person has Rhonda, okay. If a person is blind or visually impaired, they're going to be receiving services from SBVI. Yeah. A little bit on the services. All services must be needed to obtain or maintain employment, so they're all going to have that. They're all going to focus back on that employment goal. The employment and related services are jointly agreed upon and put in the individualized plan for employment. That's part of one of the primary responsibilities of the VR counselor, is to put that individualized plan for employment together and have the person be a partner in that plan for services. Some of the services that we provide in VR do not require a financial needs test, while others do. And services can vary greatly. Everyone's receiving vocational rehabilitation counseling and guidance, but other services are individualized to the person's needs. Could be job placement and job coaching. It could be help with post-secondary education, other training, assistive technology. There's project skills and other services for specifically for transition youth, youth with disabilities. Like I said, it really varies based on the person's needs and interests and capabilities.
What about somebody that maybe doesn't know what they want to do? They just know they want to work.
Mm-hmm.
Does your staff also help them maybe try to find something?
Job exploration, figuring out.
Yeah, they do that too?
Yep. And there are services like a situational assessment, is a person trying out a job basically in the community. And so some of the services we're providing come directly from the counselor, and some of the services we're purchasing from providers in the community.
Okay.
Next page, a little bit on the Assisted Daily Living Services Waiver, and I know, Leslie, you're pretty familiar with the ADLS waiver.
Yep.
The ADLS waiver provides services and supports to qualifying individuals with quadriplegia to support them to live independently in their home, community, and workplace. A little bit more on the waiver. This provides services and supports to qualifying individuals with quadriplegia. Eligibility. Eligibility is much the same as it is for your HOPE Medicaid waiver.
Yep.
And with the one big difference being that need to have that limited use of all four limbs. And the ADLS waiver is self-directed. That's really the other big difference between the two waivers. Although you know that there have been individuals participants who have, depending on what their preference at the time, I guess, they have been served by either waiver. So I mean that tells you a little bit about the similarities between the two waivers, really. The primary, well, I think I cover that a little bit later. Hold on a second. Oh yeah. I'll go on to the next slide here. The provider network. We have 3 main providers, independent living choices. The main office is in Sioux Falls there, and they cover the state, the entire state. Home Care Services of South Dakota, and they're headquartered in Pierre, and they also have statewide coverage. Preferred Home Health, their main office is in Buffalo, and they cover the west side of the state. And actually, very recently, we've added Right at Home to the list of providers, so we now have 4 providers, and these 4 are the providers that provide those personal attendant services and consumer prep services under the ADLS waiver. So a little bit more about services. Personal attendant services, really the key service under the ADLS Medicaid waiver. There really is, if you're on the ADLS waiver, you're getting PA services. That's why people sign up for a Medicaid waiver, or at least this one. Consumer preparation is the provider working with the participant to help them self-direct. In basic terms, other services available: skilled nursing services, specialized medical equipment, supplies, vehicle mods, home mods, and more. Currently, I think as of the other day, 105 participants on the ADLS waiver. So
suppose that'd be the other big difference between theirs and ours.
A much smaller way.
Much smaller group.
Well, a limited target population there, really.
Yep.
So, next slide, independent living services. So we're partnering with Centers for Independent Living and the Statewide Independent Living Council to provide independent living services. Really an array of services for individuals with significant disabilities to assist them to maintain or gain independence in their home, community, or job. Some of the next slide gives information on the 3 centers for independent living choices in Sioux Falls, the Native American Advocacy Program located in Herrick, and Western Resources for Independent Living that is in Rapid City. The next slide is simply the map, the coverage area for those 3 centers for independent living. So you can see the green is WRIL, the yellow is ILC, and then the red is the coverage area for the American Advocacy Program. Next slide gives a little bit of information on independent living, eligibility for independent living. The person must have a significant physical, mental, or cognitive or sensory impairment, must have substantial limitations in their ability to function independently in the family or community, and they must have the potential to improve their ability to function or continue functioning, moving towards functioning independently in the family or community. The core services you see there bulleted, information and referral services, independent living skills training, peer support, peer counseling services, individual and system advocacy, and the one that was most recently added to the core services is transition either from a nursing home to community or from youth from school to post-secondary life. Yeah, and that was just recently added to the list of core services, and there's other things that the Center for Independent Living will do for you as well if you have that particular need. Again, what they're doing is identifying what you need, and then
often you find the resources to provide it.
That's right. All right, where are we at now? Telecommunication relay services, and like you said, Leslie, some of this might be familiar to some of your staff, some LTSS staff from a presentation last year.
Mm-hmm.
Telecommunication relay services, also known as Relay South Dakota. This is a service that is available 24 hours a day, 365 days a year with no restrictions on the length or number of calls placed. This is basically a service available where a person who is deaf or for instance can call 711 to connect to a communication assistant, and that communication assistant facilitates a phone call with whoever the person who's deaf needs to get a hold of. And there are other various forms of TRS. This was something that was a part of the Americans with Disabilities Act, but actually South Dakota was a little bit ahead of the ADA when it came to implementing TRS services. It allows people with hearing or speech disabilities to communicate with hearing people.
Mm-hmm.
The TED and TAD programs, or Telecommunication Equipment Distribution and Telecommunication Adaptive Devices programs. These are equipment programs that have been in place for about as long as the TRS service has been in place as well. This very simply is putting the devices in the hands of the people with disabilities that they need to use TRS services or otherwise who can't use a regular phone for telecommunication. And many times I imagine that there's some crossover here with LTSS folks when it comes to the telecommunication equipment distribution program. One of the amplified phones are a real hot seller when it comes to that, and they serve a number of older individuals. Sometimes
Bigger.
what's that?
Bigger keys. So they
Bigger
can see 'em
keys,
easier.
amplified. The amplified telephones are the if you hear Julie over there yelling into her phone, she's talking to one of her clients. Yeah.
With Eric, with the iPads and iPhones, have you found over these last couple of years that the assistive technology that you've been trying to provide to people has gone up with the use of the iPad or iPhone?
What we've done over the last couple of years as a result of some legislation in the 2014 legislative session, we introduced iPads and iPhones into the TED and TAD programs, and that was partly as a result of well, maybe you're familiar with the TTY, the phone that you use to communicate with someone who's deaf. You put the receiver on that unit, and then you can speak your message, and you communicate that way, right? Well, that is old technology, considered to be old technology, really being taken over by newer technology. The iPad and the iPhone are a couple of the devices that have been in demand. It allows someone who uses American Sign Language, for instance, to communicate directly with another ASL user without even going through the TRS, without even using a communication assistant, right?
That's
so
cool.
they can communicate by distance just by using that device and the camera.
Yeah, sure,
right?
That makes sense.
FaceTime, I suppose.
Yeah,
Yeah,
exactly.
FaceTime.
Yep.
We do have a question here. It says, who do we contact if we have a consumer who needs one of these phones? Just your local resource
Well,
on the DRS website?
RelaySD.com will give you the contact information. Is it Relay? I don't remember if it's SD Relay or Relay SD. I think it's Relay SD. But that is a standalone website, and let me make sure I got the website for you. There we go. Yeah, it's RelaySD.com, and so you can find the contact information for the provider on there. We contract for these services, so someone who is, in addition to Julie covers the central part of the state. Then we have a contract provider who is located in Aberdeen and Sioux Falls and Rapid City, who cover the rest of the state, and so their contact information will be on that website.
Great.
And you can always contact Julie or Janet if you need that contact information as well.
Great.
That is my time, Leslie.
Yeah.
So I hope I tackled what you wanted me to tackle there.
Absolutely.
Some of it was short and sweet.
We do have a few questions. Well, at least one question, and be sure to type your questions in quick before we move into the next presentation if you have some. But the next question we have in the Q&A is, does Right at Home cover statewide?
I don't know the answer to that question. I'm not sure.
We'll follow up on that.
Yeah.
Anybody else have any questions for Eric? Feel free to unmute yourself or use the Q&A.
Well,
you can always feel free to email me questions later on, and I can certainly follow up with Eric and get back to everyone.
Yep, you have to do so.
Okay, and thank you, Eric, for your time today. Really, really appreciate hearing more about rehabilitative services.
Thanks for having me.
Yeah. Okay, everybody, next up is Daryl Milner. He's the director of the Division of Developmental Disabilities. And just give me a minute here while I get that presentation up.
started?
Yeah, go ahead and get
All
started.
right. Good afternoon. My name is Daryl Milner. I'm the director of the Division of Developmental Disabilities. I've been with the department now for about 10 years, and I've worked in both the Office of Budget and Finance as well as the Division of Developmental Disabilities. Look forward to the conversation today and providing a brief overview of the Division of DD and kind of what our role is within the Department of Human Services. And I'd also like to just start out by welcoming everybody to our department. And with that, I will go ahead and get started. On the next slide here is the Division of DD's mission statement, which is to ensure that people with intellectual and developmental disabilities have equal opportunities and receive the services and supports they need to live and work in South Dakota communities. And so I'll spend a little bit of time talking about our programs aimed to achieve our mission. The key thing at this point, I would say, is that our target population has intellectual and developmental disabilities, and generally what that means is a person with an IQ score of 70 or below, with concurring deficits in functional limitations. Generally, when a person's IQ score is below 70, that would qualify as an intellectual disability. But we also support people with other conditions that closely resemble an intellectual disability, such as autism or cerebral palsy or epilepsy, fetal alcohol syndrome, TBI. Those kinds of conditions, we generally see a low IQ score and low deficits in activities of daily living, and so that population is also a group of individuals that we support, and we support people through various programs within the division, which on the next slide we kind of get into, and I'll discuss a little bit more detail about each program. The Choices Medicaid Waiver serves about 2,700 people at an average annual cost of just over $45,000. And through this waiver program, we certify and fund 20 now community support providers across the state in 16 communities with IDDD. And within this program, we deliver comprehensive services in residential settings, such as group home settings or supervised apartment settings, but also in people's own homes, apartments, and even in the family home setting, in order for people to receive the supports they need to successfully remain in their home and work in their communities. Let's see. The Choices Waivers is probably what I would say is the flagship of our division. It makes up the vast majority of our funding, of our budget. We draw down federal financial participation at FMAP to fund people's services and supports in the community. As I mentioned, we contract with the 19 community support providers, and we have administrative rules under Article 4611 that governs the provision of services under all of the programs that I'm talking about, including the Choices Waiver Program. And so the Choices Waiver Program is a waiver of institutional level of care. And so or an intermediate care facility for individuals with intellectual and developmental disabilities. So it's the same level of care as the people who are supported at the South Dakota Developmental Center in Redfield. So we naturally work very closely with the staff at the developmental center to transition people outside of the developmental center and into the care of a community support provider or back to the family home. We also work very closely with the developmental center in providing consultation services as needed when an individual may be experiencing some challenging issues in their community setting. SDDC staff have the knowledge and capability to come on site to where the person lives and provide them and their staff with consultation services to aim to continuing to meet the person's need in the community setting. The Family Support 360 Medicaid waiver is the next program. It's the second largest program within the division of DD. That supports about 1,200 people at an average annual cost of $4,300. So a significant swing from choices, which, as I mentioned, is that comprehensive round-the-clock waiver. So we would expect people with more significant need to be supported in the choices waiver, whereas in the family support waiver, these are primarily children. There are some adults. Both waivers, choices and family support, supports people theoretically from birth to end of life, but we generally see adults being supported through choices and children still residing with their parents or family member through the Family Support 360 waiver. We do not deliver residential services, which really contributes to that swing in average annual cost between both waivers. In the choices waiver with the average annual cost at just over $45,000, most of those dollars are going towards funding residential services. So in the family support, we don't have that residential support, so it's much more cost effective.
I assume that we have a question in there. That annual average cost, is that per person?
Correct.
Yep.
That's the per capita, per person, per year cost for services in both programs. What we're looking to do, and I was going to talk a little bit about this in future slides, but since the dollar amount discrepancy here is so obvious, I think it's important to note we are working to kind of right size that, if you will, and not only serve more people in family support, but provide more funding to families to continue to support their family member in their own home as they age throughout life. The really cool thing about the Family Support 360 waiver is that it is a self-directed waiver. And so what that means is families are able to take an allotment of funding, so on average $4,300, and use that money to go out and hire staff to come into the family home and support their family member. If we were to, we're looking at ways to add more money and increase that $4,300, so it would afford families greater flexibility to continue to support their family member into adulthood. What we generally see is as children age into the adult system at the age of 21, they generally transition to the choices waiver, and unfortunately we see a lot of those transitions into group homes and sheltered workshops, and that's something we're certainly looking to avoid over the long term and keep people in a less restrictive setting. So we're really looking at enhancing those family supports. And like I said, I'll talk more about that in a couple slides here. We also have a program, Respite Care Services, which supports about 725 people. The average annual cost there is $598, which isn't a whole lot, especially when you consider staff recruitment and the cost to pay for staff. That's where that money goes towards, is paying the wages of staff to come in and provide that respite. The family does have flexibility to bring in anybody who would pass a background check. So they're not tied to community support provider staff, for example. They can bring in their neighbor, their friends, family members, other people to come in and provide that respite. That is another piece that we're looking to increase the rates on each year. Kind of halfway through the year, we conduct an analysis to determine how much of the cost have been utilized by the 725 people, and if we notice some flexibility there to expend more funding, we'll increase that rate kind of mid-year for the families who are using it. We do oversee one private intermediate care facility that is Lifescape, formerly Children's Care Hospital and School in Sioux Falls. Currently we support just over 50 children there at an average cost of $516 per day. So as I mentioned, that's the only private ICF in the state. So the 50 children that are supported there have high medical needs, as well as high behavioral challenges, and many times families have exhausted all of their options in terms of supporting their own child, and so they seek ICF services from Lifescape. That's a high number for my liking, as well as when you look at the national statistics, that is a large number. South Dakota is one of the higher states that supports children in ICF settings, whether it be in Lifescape or at the developmental center. So that's something Secretary Pearson and Barb Abelin at the developmental center, as well as myself, are working very hard to address and build more community capacity, specifically for children. The Division of DD, our current year budget is just over $144.3 million, and again, most of that, I would say probably about 120 or so million, funds the services through the Choices Waiver program. In total, the Division of DD supports about 5,600 South Dakotans with IDDD. The next slide gets into greater detail of the two of our largest programs, the Choices Waiver and the Family Support Waiver, and it describes the services that are provided within each. You'll notice both waivers, as with all waivers, all Medicaid waivers, where we don't fund room and board. That is not allowable through waiver programs, and so a person's room and board, if they're receiving a residential service, is funded through their benefits, typically through their SSI payments. The big thing in Choices, you'll notice the first bullet says conflict-free service coordination or conflict-free case management. That was a significant initiative that we undertook at the start of this current fiscal year, where we separated the provision of case management from direct supports. And so now we have a group of providers that only provide case management, and we have a group of providers that only provide direct supports. And so it's enabled us to be conflict-free, which is a federal requirement, and it's also been able to enabled us to ensure that people's needs are met without that inherent conflict when a provider is delivering both case management and direct supports. You'll notice the family support services are pretty similar to the HOPE waiver, and so it's very similar, but a different target population. Eligibility for both waivers are the same. They both share the same level of care, people with intellectual and developmental disabilities, and that level of care being the South Dakota Developmental Center level of care. The next slide talks about our recent initiatives and successes. We like to point out a recent report that came out from the United Cerebral Palsy organization, who conducted a study and ranked South Dakota 9th nationally in terms of delivering community-based IDDD supports, which we're very proud of. We certainly have a lot of work to do yet, but we like to recognize our successes as we go. Already talked about implementation of the federally mandated conflict-free case management. We were recently accepted into a national community of practice for supporting families. It's started out as a consortium of states working together to strengthen best practices in supporting families that include a member with an IDDD across the lifespan. And we've established a community of practice state team that will complete a work plan and strengthen the role of families in all models of services. So we're very excited about that opportunity. We're also working to strengthen employment practices, knowing that WIOA is a factor, and knowing that the HCBS settings rule, where waiver systems are required to support people in the least restrictive setting and ensure that community access is available to all people with disabilities. And so we're working hard to update our employment definitions within our waiver programs to ensure that people aren't getting stuck in those sheltered workshop environments. And if they truly want to work in a competitive, integrated setting, that those options are made available to them and they're able to work towards those options.
Daryl, we have a question in the Q&A. It says, how do you ensure timely communication between the entities in the conflict-free case management? Do you find that they work together pretty well, or?
Well, we're in our first year. We saw our first transition occur in July of last year, and we got all 2,700 transitioned by November. So we're literally months out from having conflict-free case management, and so there are growing pains certainly that we're challenged with daily, and one of those challenges does include communication, providing documentation amongst both organizations, and so we're working through those. I'm hoping we'll continue to learn and grow from the experience. We are using an IT system called Therup that houses the individualized service plan and acts as that IT solution for organizations to share documentation and communicate And so that's been there's been some ups and downs there. But with any significant initiative, there's certainly bumps in the road, and so we'll continue to work through those. But really good question. Technology pilots is another initiative that we're really excited about. Knowing that there's a workforce and funding crisis in our state, not just in our system, but LTSS sees it in the nursing home, assisted living system. There's a lack of workforce, and there's a lack of funding as well. And so what we're looking to do to kind of mitigate those barriers is allow our providers to use technology where applicable. So whether it be within a person's group home setting and we use sensors or remote monitoring to support people, or if a person is needing to access a bus route to get to work, using a wayfinder technology to assist that person in traveling. So we're trying these different technologies to enhance people's independence and lessen their reliance on paid staff. And so we have a series of pilots going on throughout the state, and we're monitoring how those are working and monitoring whether or not people are achieving outcomes. And we hope to wrap those pilots up in the near future and take what we've learned and incorporate it into our waiver programs and scale the use of technology statewide. Planning for the future is the next slide, and I know I'm kind of short on time, but planning for the future, we're embarking on a 5-year systems change planning effort, kind of going back to what I talk about, enhancing the family and reducing our reliance on paid staff and provider-owned settings, and shifting resources and dollars into the family homes. What we've seen, what we've realized, what we know from data is that when we shift resources to families, they really know how to spend it. They know how to use their resources a whole lot better than providers. I would go out on a ledge and say. So we're really looking to shift resources out of choices. We're not closing the front door on group homes, nor are we doing that with sheltered workshops. We know that there is going to be a subset of the entire IDDD population that need a higher level of support in their communities. But we also know there's a lot of people in group homes, sheltered workshops that don't need to be and really are able and want to work and be more independent and not have to rely on a paid staff at a provider. So we have a 5-year plan that we're working with a consultant with, and we're really excited about that. And the next couple of slides really just get into that, what our focus is over the course of the next several years. We want to increase the number of people in competitive integrated employment. We want more qualified providers across the state. Right now we have, I talked about 20 community support providers. We don't think that's enough because of the number of people that are in need of community supports. And one of the barriers we have there is we have an administrative rule that requires our providers to be a nonprofit organization. We're working with our department attorney to draft new rules and submit that or present that to the Legislative Interim Rules Committee, so that we can bring in for-profit organizations, which are really going to open up the door for more qualified providers to come in. Talked about the technology supports. We're really excited about continuing to learn from those pilots. We need to develop crisis intervention supports. All too often, when a person experiences a crisis in the community, providers seek a placement at a higher level of care, whether it be HSC, whether it be a nursing home, SDDC, behavioral health facility. We need to build the capacity in the community for our providers to meet people's needs in their communities, and really develop those prevention those prevention mechanisms before a person even reaches that crisis. So we're looking at telehealth, we're looking at crisis diversion programs. So a lot of work there to be done. We're engaged with the Centers for Disabilities on a really cool project to develop crisis prevention and intervention. And we're restructuring our stakeholder engagement. We had so many stakeholder groups, and it seemed like there was a whole lot of overlapping of stakeholder engagement. And so we took a strong look at all of our stakeholder groups. We've combined them where necessary, and we refocused their purpose to hopefully help us achieve our 5-year vision. The last 2 slides are really just, again, emphasizing the family dynamic. And I'm probably sound like I'm on a soapbox, but families is really where I see our system going. I had an opportunity to visit with a group of families in Sioux Falls last week who live in Brandon, and their sons and daughters are in high school, and they're rapidly approaching that transition age, and they're starting to think about what does adult life look, and parents are concerned that their son and daughters have no choice but to relocate to Sioux Falls, to a community where they're not familiar. They don't have those natural supports. Their family members are in Brandon, and so putting policies and capacity in place in places like Brandon so that people don't have to worry about sending their son or daughter to the closest community where a provider is at. And so empowering those families, shifting those resources to families so that their sons and daughters can stay in Brandon or Timberlake or Hartford or wherever, outside of those only the 16 communities where a provider has an actual facility. So that's really our big focus heading in to the future. So with that, I don't have anything else, but I'd be happy to answer any questions.
Yeah. Do you guys have any questions? While we wait to see if anybody types something in the Q&A, I wanted to just go back real quickly to this slide where it talks specifically about choices and family support. Is there anything specifically, because you said that both waivers support people from young to end of life, so is it mainly the services that are provided under each, or is it the self-direction that kind of helps people decide which way to go?
Good question. I would say that it's a combination of both. Again, in choices, you're not going to have residential support, so a lot of times families consider that. Does my son or daughter need round-the-clock residential support outside of the family home? If that's something that they need, they'll generally look to choices. But if they feel like, I can meet my family member's need in my own home, I just need some resources, I need respite, I need staff to come in and provide personal care, companion care, those kinds of things, then they'll generally look to family support. Because once a child, and it kind of goes back to my Brandon example, the families in Brandon. Once a person transitions to choices and they get caught up in those high intense round the clock facilities like a group home, they tend to don't have a way out, and we're hoping that with conflict-free case management, we see more people transition out of group homes, because you have that third-party advocate saying, wait a minute, this person doesn't really need group home. So let's provide the habilitative services, training, whatever it is, to get them to a more independent setting. So families think about that. They really like the self-direction piece of it, because they don't have to rely on a provider. They can take that allotment of funding and go out, and they really have the autonomy to do what they want with those resources. So again, I think it's the self-direction and the service mix that families look to in terms of choice. Now, they also look at that, back to the third slide, they also look at the average cost.
Sure.
And so we have a lot of families that want to continue to support their family member, but they say, for $4,300, I can't do it.
Yeah. Okay.
So again, part of my vision, part of my goal is to shift those resources and get that $4,300 higher.
Okay. We do have one question, looks like, here in the Q&A. It says, what can be done for a consumer who wants to participate in a day program like Northern Hills Training Center, but they want to continue to live in the family home, but the family needs assistance daily with personal care and individual? It sounds like this person tried Support 360. It just wasn't enough support.
Yeah.
So they have to be in a residential setting for the choices?
No.
No,
a person does not have to have residential as a support if they're on choices. They could also be living in their own apartment and have staff come in and assist them, and that could be a residential service.
Maybe the better question on this one would be, who could they contact for more information or to help them with a specific situation like this?
If the person, I would start with John New, the Family Support 360 Waiver Manager.
Okay.
If the person is already on family support, they can work through their service coordinator, their family support service coordinator. If they're not receiving services through any one of our programs, or if they're on choices, they
looks
can
like they're on
John.
our waiver now, but
okay.
Yeah.
Yep. So I'd start with John New and talk about additional resources. There's opportunity for the family to contract with a CSP, for example, to provide day services. Yep.
She said they're 22 and done with school, so.
Okay.
I will get you that information, Shelley. Okay, in the interest of time now, any other questions for Daryl before we move on to the next one? Okay, thanks, Daryl.
Thank you
appreciate
very
your time
much.
today.
You bet.
Okay, next up is Rhonda Williams. She is the Deputy Director for the Services to the Blind and Visually Impaired. And again, just as a reminder, and FYI for you, Rhonda, last year we had Janet and Julie and Sandy all come over and they did a webinar for us. So some of this might be a little bit of a repeat for some of our staff, but we also have a lot of new staff. So it'll be kind of a mix out there.
Sure.
But go ahead and get started when you're ready.
As Leslie said, my name is Rhonda Williams. I'm Assistant Director. Now we don't call it Deputy, but Assistant Director for Service to the Blind and Visually Impaired. A little history about me. I actually started with Department of Human Services back as a rehabilitation counselor.
The system has detected that a minimum number of lines are connected to this conference. Do you want to continue your meeting? Press 1 to confirm. If there is no response, the conference will end.
Oh my.
Oh. Yep. Keep going.
Yeah.
Okay. Was a VR counselor for several years and then moved up as a VR program specialist within Division of Rehab Services. Became very familiar with all the policies and procedures in our case management system. I was doing that for about 10 years. Then I moved over to become the Assistive Daily Living Services Waiver Manager, and I presented on that a few times, and maybe some of you may remember me as the ADLS Waiver Manager. I did that for about 3 years. Last August, I moved over to become the Assistant Director for Service to the Blind and Visually Impaired. We are a smaller agency within the Department of Human Services, and we work obviously specifically with people who are blind and visually impaired. We have four FTE within the state office here at Hillsby Plaza in Pierre. Gay Matke is our division director. She oversees all the programs in the budget within SBVI. I supervise 7 VR counselors around the state, located in Pierre, Rapid City, Aberdeen, and Sioux Falls. We also have Sandy Neihart, who manages the Older Blind Independent Living program. And she also supervises 5 rehabilitation teachers around the state in Rapid City, Aberdeen, Sioux Falls, and Pierre. And finally, Nancy Hoyme is the program specialist here in the office for the Business Enterprise program. And I'll be talking about all of these programs in a little more detail as we move on. And as a side note, a majority of the funds that we have within our division are federal funds and state match funds. So obviously we've got some federal regulations that we have to follow. The next slide is just an organizational chart. Good luck reading that.
I do have a copy of the PDF version of your presentation to look at if needed.
I printed it out and I can't read it, but I already know what it says. So, one staff person I haven't mentioned yet is Dawn Backer. She manages the South Dakota Rehabilitation Center for the Blind in Sioux Falls. So you'll see her on this list. She supervises 11 staff located there. I'll also be going into more detail about that program in the future slides. So in addition to the full-time employees that we have within these state positions, the VR counselors that I supervise, the rehab teachers that Sandy supervises, we also have FTE for drivers, and you'll see quite a few, I think 11 drivers listed here that Nancy Hoyme kind of handles that whole thing, and that's for our SBVI staff that have low vision or unable to drive, as well as board members who are blind or visually impaired, and we hire these drivers to transport our staff and the board members to the board meetings and that sort of thing. So they're obviously part-time staff.
Gotcha.
Service to the blind and visually impaired is co-located with Division of Rehab Services around the state. We also share clerical support with DRS. We have our SBVI VR counselors, DRS VR counselors, our SBVI rehab teachers, and then support staff within those shared offices. We also share the same case management systems. So we work very, very closely together. There are many states who have combined agencies. They don't have a blind agency. They're all just combined, like Division of Rehabilitation Services. I'm sure Eric mentioned they provide services to people with all disabilities, except people with blindness and low vision. In many states,
which is weird,
it's all combined.
Oh, okay.
Yeah, I believe there are about 28 separate SBVI agencies in the nation, and some of the other, Guam and some of those other places. So we're a little unique in our area because we are Region 8, which is Utah, Wyoming, Colorado, Montana, North Dakota, and South Dakota. So we have monthly, quarterly phone calls with our region. We, share information about policies and upcoming RSA, federal things coming up the pike, and how are we doing, what are we doing to come into compliance with all that. But South Dakota is the only one with a blind agency, so kind of feel like we're out here by ourselves.
Yeah.
The fortunate thing is that we do have blind agencies in Nebraska and Iowa, so they're not within our region, but they're still close by. We have the same eligibility criteria as the Division of Rehabilitation Services for our vocational rehabilitation program, with the exception that obviously they have to have a visual disability that interferes with obtaining or retaining employment. They must be able to benefit from services in terms of an outcome, an employment outcome, and require our services in order to be successful in employment. So here's an example. This is a map showing the different territories that our VR counselors cover. So like I said, I supervise these 7 staff around the state, and you can see where they travel. Or because we only have 7, they obviously are traveling more. Mm-hmm. We do have, obviously in Pennington County and Minnehaha County, we've got more than one counselor covering those areas. But that gives you an example of our territory coverage area and contact information, name and contact information for each VR counselor. Just taking a look at the SBVI VR program, we've served 509 people last year. We served that many, and we helped 115 people become successfully employed in the community. Majority of those jobs you can see from this chart here were in service, sales, and production and construction. We start working with VR clients in high school and work through that transition, giving them some work experiences, work towards going into post-secondary education if it's appropriate. Then we also work with people who are just out seeking jobs and employees who are currently working but need some additional assistance to maintain their job. So as far as how much we spend on VR cases, we spent about $1,272,000 on client services for the vocational rehabilitation program last year. You can see that physical restoration and assistive technology services and devices constituted about half of our case service expenditures, and that is a difference for SBVI than you would see within the Division of Rehabilitation Services. Mm-hmm. We help a lot of people with physical restoration services, medical services actually, to help repair some of the deterioration of their vision. Mm-hmm. We can go in and assist with surgeries when they're not medically able to afford it themselves, as long as it's employment related. Mm-hmm. So you'll see more of our clients are actually already have a job, and their vision is deteriorating, and they need assistance with something such as assistive technology or physical restoration in order to maintain that job.
Yeah, I didn't know you did physical restoration at all, so that's news to me.
Yep, we do have some, and that is very different from DRS, mm-hmm. which is, when I came over here, it's very different. It's a huge learning curve for me to learn about that. People with detached retinas, that can come on very suddenly, mm-hmm. and if you don't get it taken care of right away, you will have permanent vision loss. And so another thing we also do for people who don't have that medical insurance, that need that service to maintain their job, they'll can't come in, and it's kind of an emergency situation. We have to make them eligible as soon as possible so that they can go in and get that physical restoration done and get it fixed so that they can maintain that job and continue on and keep that eye health going. And then assistive technology, like I mentioned before, people whose you'll see that their vision is deteriorating. Medical services may not be of benefit or helpful to them, but getting that assistive technology to overcome some of those issues with their vision so that they can work and maintain that job. We do spend quite a bit on that. And both of those, many of these services that we provide, they do have to meet financial need. So we do have a financial cap, as far as, I shouldn't say cap, but they have to meet financial need in order to qualify for some of these services.
Sure.
And we look at comparable benefits too. So if somebody's got insurance and it covers that surgery, then obviously we're going to look at that first. So next slide. Yeah, I guess as far as, the other services that we provide under the Vocational Rehabilitation Program, I'm sure Eric explained some of that in more detail. We do the same thing. I just kind of gave you a little more information about some of these additional services that we provide. The Older Blind Independent Living Program, as I mentioned earlier, Sandy Neihart manages that program. Rehabilitation teachers that are located in our local offices provide services directly in the home of these IL clients. We provided services to over 600 individuals last year, teaching them alternative methods of doing everyday activities, learning skills that will help them become more independent. And some examples of that are learning how to use a white cane to travel around their community or in their home, learning about communication, whether it's Braille or how to use some assistive technology on their computer or an iPhone, just learning some of those apps that are able to allow them to function better for communication. Telling time, they'll distribute talking clocks, for example. Homemaking activities, there are gadgets that can be set up around the home, and they can put raised dots on appliances. You see many of the appliances now, microwaves that are totally flat. You can't feel anything. Someone who has a vision impairment have no idea how to set that unless you put some dots or something where they can identify what's where, and then they can set the microwave or the washer and dryer and know that they have the right setting so that they can do that independently. We also hand out a lot of low vision magnification devices, lots of shades for people who have issues with glare, assist with other leisure activities, and refer to any public and private organizations out in the community that may benefit them as well. The Older Blind program is for people age 55 and older, which can be kind of offensive to some of us who are getting close to that age. I would consider 55 to be older blind.
We're already familiar with some of that in our division.
Let's see. Okay, so the next slide is a map of where the rehab teachers are located. Sandy Neihart supervises them. We do have 2 rehab counselors that are actually also rehab teachers. One of them is located in the Rapid City office, and one is right here in Pierre. You can see the middle section in white. Dorothy Adams covers that as a rehab teacher and as a VR counselor. So, for some of these rural areas, we want to make efficient use of staff time. So if they're going to go up and travel to, Dewey County or Walworth County, then they can go up and provide VR and IL services instead of having 2 separate staff do that. Sure. So that's what that's all about, and it seems to work really well. And I know our VR counselors that do both love doing the IL part of it too. They love to be able to provide both types of services to people. Yeah.
Oh, that's good.
Yeah. So this gives you an idea, this next slide, of the primary types of eye diseases of people that we serve. You can see that macular degeneration was a major cause of the vision loss in 333 of the 472 individuals who received services last year. We also help people who have diabetic retinopathy, glaucoma, cataracts. We've removed cataracts for people and done various things for people with, diabetic retinopathy, just doing what we can to help them maintain their diabetic health, because if they don't, then it's going to affect their vision. It could be permanent. So we talk about the Older Blind Independent Living Program, assisting people age 55 and older. You can see in this next chart, actually not that many people in their 50s and early 60s getting the services. We're providing a lot more services to people over the age of 80. 67% of the people served were over the age of 80, and 8 people were over the age of 100 last year. So that's really cool to see that we can go in and provide services to people over 100 years old so they can be independent in their own home. Yeah.
That's awesome.
As I mentioned before, we have the South Dakota Rehabilitation Center for the Blind that's located in Sioux Falls. Don Backer is the manager there. And that's a comprehensive training program that offers training in alternative techniques for individuals who are blind or visually impaired. That program is, the goal there is to rebuild self-confidence and improve the quality of life for people that are experiencing life-changing vision loss. You'll see a lot of people with sudden onset of vision loss going there. Usually people who've had vision loss all their lives have had time to make that adjustment and learn those things as they go. But we've seen people there with traumatic brain injuries, strokes. We've had people go in for surgery for something totally unrelated and because of blood pressure issues during surgery came out of it and had no vision. Just things like that can happen. Accidents, absolutely, yep. Traumatic brain injuries and just a variety of things. So they get extensive training in skills of blindness so that they can learn how to live independently and perform those activities of daily living. Some of the skills taught at the center include orientation and mobility. We have an orientation mobility specialist there. They receive very significant training to be certified as an O&M trainer. Take people out into the community and learn how to use the white cane, learn how to cross busy streets, learn how to use the bus system, things like that. Not only outdoors, but also indoors, how to get around hallways and doorways and opening doors and that sort of thing. They also have a program there with assistive technology, got a program that is up to date with all of it, whether it's just drag and dictate, open book, showing people there's ways that you can use some software on your computer in order to become more independent and help them get a job too. Home management skills, doing meal prep, learning to shop out in the community, how to sew, do laundry, learn home mechanics and cleaning, because that's very important if you're going to be living in your home without additional assistance. You need to be able to know how to do those things. Communications such as identifying coins, learning how to fold your dollar bills a certain way in order to identify this is a $5 bill, this is a $10 bill, that sort of thing. Telling time. They have writing guides. They help as far as writing checks, that sort of thing. And they also teach Braille there. The duration of the training there can range from a couple of weeks up to a year, depending on each person's individual needs and personal goals. They offer counseling and have regular team meetings with everyone just to get updated on how they're meeting their goals. The Rehab Center for the Blind also has apartments located there in Sioux Falls for people living outside of that community, so that people coming from all over the state can come and live in the apartment and get the training that they need in order to be more independent. We do have all of our SBVI counselors and rehab teachers go to the Rehab Center for the Blind for training. Our SBVI counselors spend about 4 weeks there, and our rehab teachers spend about 8 weeks there, if I remember right, to get training, because those rehab teachers are learning how to teach those people how to do that when they go out on their own, so that they can go to the home and train those people on it for those who don't actually need to go to the Rehab Center for the Blind. Sure. And the counselors need to know enough about the program so that they know how to make appropriate referrals to the program as well. Sure. Within the Rehab Center for the Blind is the Vocational Resources Unit. There's an employment specialist there who's knowledgeable about the needs of businesses and can assist participants in employment skills training in order to obtain employment. This is the one program there at the Rehab Center for the Blind that actually a lot of Division of Rehab Service counselors refer their VR clients to. They don't necessarily have to have a vision loss. It just helps them with different computer instruction, world to work classes, job skills training. They've got assessment, and they'll train on what employer expectations are, a lot of those soft skills and job search assistance. And finally, the Business Enterprise Program is a program that Nancy Hoyme manages through the Randolph-Shepard Act. It provides opportunities for people who are legally blind to become self-employed in food service in South Dakota. We have actually vending programs. A majority of it is vending. We have 4 vendors right now in the program located in Aberdeen, Yankton, Huron, and Pierre. Right now the BEP owns 53 vending machines. Those vending machines include hot beverage, cold beverage, snacks, and a combination of all of those. Six new machines were recently purchased this year to replace the older machines, and 2 new machines were also purchased to expand the vending in a new location in Huron. We had the Knight Building Coffee Shop, and I know DSS was very familiar with that. They had to come over here. We have no coffee shop or anything fun like that. That vendor has since left, and we're training a new vendor. They also had vending machines around the state complex and the businesses here in Pierre. Right now they're working on training with getting somebody back in working with those vending machines. Not sure if the coffee shop is ever going to open or what's going to happen with that. That's kind of an unknown. But we do have coffee shops. We have the Eros Data Center is a pretty big one out by Brandon. And if you ever see any vending machines along the I-90 rest stops, those are BEP vending machines.
Okay, I didn't know that.
Yep. And just if anybody has any questions or is looking for resources, I've got contact information for the various offices throughout the state, and also information that you can access from our website, whether it's for vocational rehabilitation or independent living. And then we also have we also partner with the Division of Rehabilitations on our Ability for Hire website. And then there's just my contact information.
Okay, wonderful. Does anybody have any questions for Rhonda? We're running just a couple minutes behind, but I want to make sure that you get all your questions answered. And again, like I said earlier, you can feel free to email Rhonda directly, or you can email me, and I can always follow up with the presenters on today's webinar. So with that, I think we'll thank Rhonda, and we'll move on to our next presentation.
Thank you. See you later.
Thank you. Okay, give me just a minute to pull it up here. Okay, and so the last presentation for the day, but certainly not the least, and I'm going to say your name wrong, so please correct me, but your name is Barb Abilene?
Close. Ablin.
Ablin. Knew it was going to go either way. So Barb Ablin with the South Dakota Developmental Center is here today. She normally offices in Redfield,
Yes.
but she's here today to meet with us in person for today's webinar. So I'll let Barb get started.
Okay. You've got us up and running. Perfect. And hopefully my voice doesn't go. It's allergy season. The South Dakota Developmental Center is located in Redfield, and we are under the Department of Human Services. I'm going to go through some historical information here first. SDDC was established by an act of the legislature in 1899, and it opened its doors on February 1st, 1902. And the name of it was the Northern Hospital for the Insane. By July of that year, there were 45 patients who had been admitted, and Granite is the building that's pictured, and that was the only building on campus, and it housed the patients, the superintendent and his family, along with all other employees, administrative offices, the power plant, and the laundry.
Wow.
I know.
It was stuffed, I bet.
Yeah, it was. The first superintendent was Dr. Knutski, and he asked for a name change for the facility from the very beginning. And in 1913, the name was changed to the State School and Home for the Feeble-Minded. None of these names are attractive, are they?
No, they're not.
In the early years, the primary concern was for custodial care of the people, and the goal was to keep them separate from the rest of the world. And this was believed to be beneficial for them as well as for society. So SDDC was built on a hill outside of town, outside of Redfield, and it was separated from the community by a creek. So it really was kept separate. As times changed, so did the views towards people with developmental disabilities. In 1951, the name was again changed, and this time it was changed to the Redfield State Hospital and School. In the early 1960s, there was a belief that people with DD should be in centralized state-run institutions, and because of this, the population of the center grew to 1,199, which was our peak population for the facility. In the 1970s, deinstitutionalization and normalization became the key philosophies. It was felt that the people at SDDC could do almost everything that anyone else could. They just needed some training. So in 1975, another change came to the facility under the heading of Title 19 or Medicaid and the associated regulations, which would standardize the care and treatment of the people who were entitled to health, safety, and comfort. By 1980, the population was at 499 people living at the facility, and the goals had changed to developing the skills of the individuals to live independently. So the name of the facility was again changed to reflect that mission. And so in 1989, the facility became known as the South Dakota Developmental Center. Okay, SDDC's current census is at 119 people, and later in this presentation, we will explore the population in a little more detail. That is a photo of the greenhouse. So they grow plants under grow lights, and then they bring them up and they have sales.
That's pretty cool.
So yeah, it's a gardening club. I am a member of the South Dakota Developmental Center team, which is comprised of 374.6 full-time employees, and of those FTEs, there are 184.5 direct support professionals. SDDC is a public and residential intermediate care facility for individuals with intellectual disabilities, and we provide supports and services for persons with disabilities and other persons who may benefit from those supports and services offered at the agency. The SDDC provides on-site and off-site additional supports and services to increase the self-direction of the people receiving supports. Excuse me. Eligibility. The people supported at SDDC must have an intellectual or developmental disability as defined in law. Their ability to function independently is substantially limited, and their disability occurs before the age of 22. The utilization review team must have determined that the person is in need of ICF-IID services and active treatment, and this determination is also reviewed annually. The individual must have unsuccessfully received treatment in a less restrictive environment, and the individual displays behaviors that are dangerous or cause concern for the safety of the individual and or others. and all people supported at SDDC qualify for funding through Medicaid Title 19. So as I stated, developmental disability is defined in law, and it is any severe chronic disability of a person that is, one, attributable to a mental or physical impairment or combination of mental and physical impairments, is manifested before the person attains the age of 22, 3, is likely to continue indefinitely, 4, results in substantial functional limitations in 3 or more of the following areas of major life activity, being self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency, and 5, reflects the person's need for an array of generic services that are met through a system of individualized planning and supports over an extended time, including those of a lifelong duration. And South Dakota Codified Law defines an intellectual disability as a condition that was previously referred to as mental retardation or a variation of this term, and has the same meaning with respect to programs, qualifications for those programs, rights or responsibilities regarding persons with such a condition. Okay, the mission statement. That photo is of a group who assisted this spring with Feeding South Dakota.
Oh, cool.
Yeah.
It's a good program.
Yeah. The mission of the South Dakota Developmental Center is to provide comprehensive specialized services designed to enhance quality of life and community inclusion for people with intellectual disabilities or developmental disabilities. As a team, we came up with some guiding principles. When needed services are not available in a community setting, SDDC provides short-term individualized treatment services to promote skill development and self-management so people can transition to living successfully in the community. And we believe that the moment they walk through the doors, we are starting on the transition process. SDDC serves as a statewide resource, providing supports and services to stakeholders and providers through consultations, trainings, evaluations, and other supports, with the goal to assist people to live in the least restrictive environment. SDDC sustains a positive and therapeutic residential treatment environment, providing high-quality services through a knowledgeable workforce who are compensated fairly for their work and are treated with respect. SDDC encourages active participation of the person's support network, family, friends, guardians, natural supports, to strengthen those natural supports. And believing that all people have the capacity for growth and development, SDDC incorporates person-centered and positive behavior supports to maximize self-determination and independence. Provision of services in a manner which demonstrates a commitment to best practices and ethical standards while assuring financial responsibility to safeguard the ongoing ability to carry out the mission of SDDC and to advocate for the rights of persons with intellectual and developmental disabilities, and to demonstrate that commitment by respecting the dignity of those who use our services. Any questions so far? Okay. The next few slides are just an expanded view of the SDDC's one-page profile, and all employees had an opportunity to provide input into development of this one page. So our vision is that all people have a balanced right, and what we meant by that is that we all have rights, responsibilities that we need to follow. And when this basic premise is in place, natural supports are strengthened, and as a team, we provide specialized, comprehensive treatment supports. We believe that the concept of team stresses the importance of moving forward together, and that this team is comprised of the person, their natural supports, family members, guardians, and the employees of SDDC. And that a top priority is ensuring that SDDC is a safe and therapeutic environment for the people we support, as well as the employees who work here, that you need to feel safe in order for you to learn. Things people admire about SDDC. We focus on the customer, both internal and external customers, and the customer is always the priority. We view ourselves as dedicated and caring employees who take pride in the supports that we provide. We are supportive of partnerships with the person, their natural supports or family members, outside entities, and with each other as employees. We have a strong knowledge of specialized therapeutic treatment approaches. SDDC employees embrace educational opportunities both on and off campus. We provide high-quality supports that incorporate best practices, including person-centered thinking. When I give tours, people are frequently surprised to see that the SDDC campus is very beautiful. It includes a walking path, a fishing dock. There's a golf driving range. We are also partnering with SDSU in the process of developing a nature path through SDDC, and so with grasses, and there's a young man who's working with one of the environmental services staff to build bird houses and a little gnome house, and they're painting rocks, and so they're very involved in the process. So I'm excited to see what it looks like by this fall.
Yeah.
And we continue to build collaborative relationships with other in-state and out-of-state agencies. We will be traveling to Grafton, to their state hospital, the end of June. Important to SDDC is to continue to learn about and utilize best practices. Education is a priority. We know that we need to serve as a resource. We recognize that open communication is essential to the work that we do. If there's gaps, then there's problems. We identify when there are potential safety issues to ensure that everyone feels safe, as this promotes learning, and that's everyone's responsibility as employees. There's the expectation of a positive professional working environment. We involve people in normal community activities, going to church, going to sporting events, volunteering at a variety of different things. They work uptown, they shop, they go dining, etc. We focus on the recruitment and retention of quality employees with the assistance of the on-campus Bureau of Human Resources office. We ensure that employees have the resources to do their jobs. We have an on-campus training and development department, plus SDDC employees attend off-campus and out-of-state trainings. The emphasis is on using the least restrictive approaches when intervening with behavior concerns, and all staff, including myself, receive ongoing training in nonviolent crisis intervention and positive behavior supports. Important for SDDC. I've been very fortunate to participate in 3 national CMS trainings regarding the rules and federal regulations. So I'm able to share that information both with the SDDC team and other entities across the nation. And then we are surveyed annually by the Department of Health, and that's our physical layout and then also the supports that we provide. SDDC continues to incorporate PCT practices into the development of supports and utilizing PCT to learn more about the people we support, as well as learning more about each other as team members. Right now, in fact, today there was a training held where different disciplines on campus, for example, today was the behavior therapists, are being provided on training on positive and productive meetings so they can share their own meetings. We work closely with the DHS Budget and Finance Department to ensure fiscal responsibility, and we also have an on-campus budget and finance office. Again, education is important to us with building our expertise on a variety of therapeutic services that reflect best practices in the field of ID and DD. PCT has done a lot of different things for us, but it has assisted SDDC with collaborating with DHS to strengthen the delivery system. And we also work closely with community support providers, and this has provided us with a basis for a common language. We value creativity in all we do. It invites exploration, it enhances relationships, it helps with fiscal responsibility, it generates energy, it connects us with others, it helps with gaining confidence, and is a route to self-knowledge and discovery. So employees are encouraged to bring their creativity to their work to enhance the supports we provide.
I was going to say, it probably improves quality of life as well.
Yes, it does. I do have an art minor. Supports and services. People at SDDC each have an on-site case manager who is responsible for the oversight of the person's entire individual support plan. We have an activity center that has a weight room, a creative area. We also have an art room on campus. We have a library, a sensory room, a weight room, canteen, gym, and a pool. SDDC has 24/7 medical care, plus we have an arrangement with or an agreement with the local hospital for emergencies, so it's just first aid that we provide on campus. Years ago we did have an infirmary and a hospital, but we don't have that anymore. SDDC has an on-staff certified addiction counselor. We have a clinical psychologist, 7 behavior therapists, and 2 psych assistants. And Dr. Soundy and residents from USD visit twice monthly. We have an on-staff physical therapist and a consulting occupational therapist. We have an on-staff pharmacist and 2 pharm techs who work in our pharmacy. We have an on-site environmental services department, which is responsible for the care of the buildings and grounds. We have an on-staff speech-language pathologist and an SLP assistant. In our employee ability area, there are 7 industrial workshop managers and 2 job coaches. SDDC is also has an agreement with the local school. They provide the teaching staff and we provide the physical school settings. So we just had 4 graduates and a ceremony for them mid-May. We have 3 on-staff trainers. We have a Bureau of Information and Technology office on campus. We have a Human Resource office on campus. We have a large food service building and a contract with Avian's Food. and volunteers assist with weekly non-denominational services, which are held in the on-campus chapel, which was built in part with funds from parents. And there is a Birth to 3 office that's housed on campus also. Referrals. Since January 1996, all referrals are routed through the DHS Division of Developmental Disabilities. And we assist in coordinating consultation services also, and those services are aimed at identifying the supports and services that would be most beneficial to support a person to successfully live in the community and avoid requiring a higher level of support. So our behavior therapists or our pharmacists or medical staff or speech or language, whoever, even PCT coaches or direct support professionals will go out as a team and consult at community support providers, or we've been down to HSC or other areas. And then these consultations may require in-depth functional analysis of behavior and/or assistance in the development of a comprehensive positive behavior support plan. While the request for consultation will originate from community support providers, a special team meeting should be held prior to the submission of such. The next series of slides presents some demographical information over a 17-year time span. On June 30th, there were 196 people supported at SDDC, which is the highest population in that time span. And as you can see, we support more males than females, and that the smallest population supported were the adolescents and children. And Program 1 is the largest program area and supports adult males. Program 3 supports both males and females. And as part of the right sizing process, SDDC had a goal of supporting no more than 120 people. Over the past year, we have been able to close several modules and recently merged the 3 program areas to 2 living areas, which are east and west residential living areas. Next is race for the current population, and whites and Caucasians are the largest racial group, with Native Americans being the second. Totals by age group of the current population. This shows that most of the people who are supported at SDDC are between the ages of 11 to 58. The average age of females is 32.85 years. The average age of males is 33.87 years. And the average age of the total population is 33.64 years. Admissions and discharges. The highest number of discharges was in 2003, and the highest number of admissions was in 2001. Since July 2016, there have been a total of 7 admissions and 20 discharges from SDDC. Yeah. You can see we're going down.
Yeah,
nice
good.
Trend line. SDDC admission source. From 2007 through March 2017, the majority of admissions, 90, came from a mental health facility like HSC. 82 were admitted from community support providers. 44 were admitted from the family home. 42 were court-ordered or law enforcement, and 21 were from other sources, for a total of 279 admissions. The number of admissions has declined from 2009. In 2007, there were 30 admissions. 2009, there were 36. And in 2016, there were 8. And to date, we've had 3.
Yeah.
So SDDC's teams have been working hard to assist people with intellectual disabilities to remain at home or in the community. Again, we do a lot of consulting and working with the families and with other agencies. Behavior therapists and other team members provide consults at community support providers. Teams are also providing training at CSPs as well as Springfield and the Women's Prison, and this training provides staff with information on how to better support people with intellectual disabilities. And as noted in the introduction, people admitted to SDDC must meet the eligibility criteria, be in need of ICF-IID level of care, and be in need and benefiting of individualized and consistent active treatment, which is required by CMS. And admission can be voluntary, court-ordered, or board-ordered. Looks like I got a blank sheet here in mine. Okay. Minnehaha had the largest number of admissions, with Pennington County coming in second, and the state at large is from jail.
Oh, wow.
And the remainder of the counties each had 8 or less admissions. Total of 508 admissions during that time frame. And some of this data may be a little off because of our avatar. And on the next slide, this no entry made is we're having some problems with our electronic system.
Database.
So it
Gotcha.
could be a glitch that's going on there. But it shows that there were 575 discharges, and then that there was 90 readmissions. Most are coming from group homes, community residential facilities, or the family home. And the next graph is one I was really happy to see, is that the length of stay at discharge is declining down. We've got a nice trend in that, which shows that SDDC is moving towards a facility which provides short-term residential supports. When I first started working at SDDC in '72, it was a long-term placement.
Yeah.
So it's nice.
It just shows you how much the attitudes of the community at large has changed over the years, huh?
Definitely. So the highest average length of stay was at 17.139 years for 2001, with the shortest length of stay being 3.401 years during 2013. So we're moving in the right direction. The average length of stay was longer in Program 3 at 16.84 years, and that's the program area that supports older males and females. So some of them have been there a long time.
Gotcha.
And it's like home.
Yeah.
You know. And then Program 2, also known as Turtle Creek, had the lowest length of stay at 2.25 years, which was really good to see.
Yeah.
So, yeah, because we believe that children should be at home in the community and with families. So right sizing has been an ongoing process at SDDC. In April 2007, the census was at 160 people receiving supports at SDDC. And last April, there were 131 people. And as of today, the census is at 119 people. We have gone from 16 residential living modules to 13 along with 2 transitional living areas, which are governor's homes that were put together and serve, I think it's 9 people. In addition, we have taken a variety of corrective action steps as a result of employee input and self-examination of processes. And these actions have addressed safety and security issues as well as employee engagement and satisfaction. We are encouraging all employees to participate because it's our team, and we all need to be active in that process. We provide ongoing training to ensure that employees have the tools to do their jobs. As a team, we are aware that we still have work to do, but recognize that this will be a process as best practices in the field of ID and leadership continue to evolve. We will continue to implement, evaluate, and move forward with our mission of providing comprehensive specialized services designed to enhance quality of life and community inclusion for people with ID or DD. And the last slide is, if you are interested in learning more about SDDC and the supports we provide, please visit our website or call the 605-472-2400 number, which is our main switchboard, and they can put you through to me or to Twyla or to anyone. And we would be happy to arrange a tour if you're interested in visiting the campus.
Okay. That was an excellent presentation, Barb. I appreciate that. Do any of you have any questions for Barb before we end the webinar today? I know we're running a little bit behind, but I wanted to still give you time to ask questions if you have any. Okay, it doesn't appear anybody's going to type any questions. Again, just like with all the other presentations, if you do think of questions in the next few weeks that you'd like answers to, you could email Barb, or feel free to email all those to me, and I can follow up with each of the directors that presented today. So otherwise, thank you all for participating. I hope you have a great rest of your week, and have a great day.